Hey, Dr. Tyson, what is an ophthalmologist?
So a lot of people want to know what an ophthalmologist is. An ophthalmologist is a medical doctor that does eyes. So ophthalmology requires 4 years of undergraduate, 4 years of medical school, 1 year of internship, and then 3 more years of residency. On top of that, you can do 1 to 2 years of fellowship. So what separates ophthalmology from optometry is that the ophthalmologist is a medical doctor, but we're going to be the ones that are doing surgery, where the optometrists in the state of Florida are able to do some disease treatment, but also glasses and contact lenses. So we work as a team in our practice, and we have our different spheres of excellence. And for me, being an ophthalmologist, it's being a cataract and glaucoma surgeon.
What about an ophthalmologist's day-to-day?
My normal day-to-day actually varies. So sometimes I'm in the clinic, and that's where I'm doing consults for surgery such as cataracts or lasers. And then on a surgical day, that'll be all day in the operating room. And then the next day I'll be seeing all those post-ops and doing more consults. And then we have some patients that have chronic diseases that we see on a 3 to 4 month basis that come in every couple months, and that allows us to actually build relationships with those patients because they become your friends. You get to see them all the time.
Now let's ask Dr. Brienen what an optometrist is.
Well, an optometrist is an individual that went to optometry school, and in optometry school we're educated on optics, so that's how light works, and also we're taught how to use different lenses and also how to do repairs on lenses, and we're also trained on the medical side. So in my situation, I'm also licensed in the state of Florida to treat eye diseases of all different kinds like glaucoma, etc., and basically take care of the needs of the patients non-surgically.
What about an optometrist's day-to-day?
Come in, I have a schedule like most doctors do, and we do everything from routine exams, we do emergency office visits, we do follow-up visits, like for people who are on glaucoma medications, we check their pressures to make sure everything is going adequately. We typically also see a lot of patients that are having vision problems, and they're related to common things such as cataracts. And then if that's the case, then we get them sent in the right direction to get those things taken care of.
Finally, let's ask Darlene what an optician is.
An optician is a person who helps pick out and select glasses that properly fit them, fit their bridge, fit the temples, fit around their ears. They fill their prescriptions from an optometrist, an ophthalmologist, and we pick the correct lenses for them, and we go through their lifestyle to find out what their needs are. Opticians also transpose prescriptions. Ophthalmologists read in plus cylinder, or optometry practices read in minus cylinder. We have to do, which is just an easy eligible transaction where we transpose the prescription into the minus cylinder. Most opticians read in minus cylinder unless they're working for an ophthalmology practice. There are opticians that also work in the lab where they do cutting and edging and finishing work for actual manufacturing of the lenses.
What about an optician's day-to-day?
On our day-to-day basis, we help the patients when they come out of the doctor's room. They also bring in prescriptions from other doctors and walk in, and we help select frames. We also do contact lenses where we show patients how to insert and remove the contacts, what they can and can't do with the contacts. And we also check in frames when we get new frame stock in. We check in the glasses when they come from the lab to make sure the prescriptions are correct. And it's an all-day job where we help our patients as much as we can.